Hi, everybody. We are here for Peeling Back the Truth podcast. Today is our 13th episode, Ashley. So we're getting up there in the numbers, and we are fortunate enough to have a really amazing guest today, Larry Helwig, who is the owner of the Clearskin Institute in Arizona, in Phoenix. And I have had the pleasure of being at the facility, and it is my dream education facility. It is so beautiful, so state of the art. They just do such wonderful things there for education and aesthetic medicine with devices and everything you can imagine. But today we're here to talk with Larry a little bit about exosomes. And, he's a big fan, and we kind of just wanted to get his take on it.
Thank you again, Larry, for being with us today as well. If you don't mind sharing with everybody, Larry, a little bit about yourself, and then we can get right into exosomes, human-based versus plant-based, and kind of pick your brain on it if you don't mind.
Okay. I'm an aesthetic nurse specialist. I've been doing this for 26 years, and there's not much in aesthetics we haven't done. My background was obviously nursing, but I became an emergency nurse practitioner. Found I made less money as a nurse practitioner than as a registered nurse in neurosurgery. So I got into sales, and that led me to laser sales. And that's how I started learning the business. And once in laser sales, I went to every talk. I took copious notes. I learned what was going on, and I'd go back, type up the notes, and study it. And pretty soon people were saying, well, you have a facility. Why don't you teach? Why don't you lecture? That type of thing. And so one thing led to another, and that's what we do today. So we're a training center. We treat and we teach, and we teach all over the United States, Canada, Mexico, and we've even done training and lectures in Europe. So we've been at it for a long time, and I think that's part of it. When you do something long enough, you tend to, learn. You get relationships, and you learn a lot about what works and what doesn't work. And I know we're going to talk about exosomes today, and we have been using exosomes for many years, and we find that they all work. So that's a nice thing. Exosomes work. We started out with exosomes that cost us about $800 per use. And it's sometimes as much as the procedure itself.
Mm-hmm.
And then we went to a different type of exosome, a company named Benev, and we used their exosomes, and it was 5 billion. They had 2.5 billion exosomes, and then they moved it to 5 billion. And we found that I think it was about $125 an application for the 5 billion, and we liked it. It was great.
Can I just say one thing, stop for 1 second before we keep going, because our viewers are not educated on exosomes. Would you just give a quick briefing of exactly what exosomes are and what they do for, the skin and why they're so beneficial?
Yeah, I'll try to go into some detail on it. But exosomes are really like signals. It's like the messenger. It tells cells what to do. And so we went with the new type of exosome from Aesthetic Management Partners, and it's plant-based. So,
and Benev was human-based, correct?
That's correct.
Okay.
And so it was like, well, wait a minute, plant, is that going to do the same thing? And so we had to do a little investigation and stuff, and they call theirs XOE. And basically they invested about 20 years of time and effort into it, about $10 million. And really what they were doing was looking at the science of extracellular nanoparticle technology. And really, when you get down to it, you start with stem cells. And the head of this company that made the plant-based is a Dr. Newman out of California, and he's pretty well known. He is a board certified dermatologist. He is a fellowship trained cosmetic surgeon. He's got an office in Beverly Hills, but he's invested a great amount of time and effort into this. And he was one of the pioneers in autologous stem cell therapy, starting many, many years ago. And so he's researched this from one end to the other. He writes papers on it, and he's presented all over the world. And he found that plant cell technology, plant cell derived, does the same thing as human, and that was really nice. So he wanted an organic stem cell. He wanted something that was going to work and do the same things, and he's been able to actually customize it. And so what's so interesting for us is most stem cells, you have one application
Mhm.
for exosomes. And with this product, you have 21 applications, in which 20 of the applications are done by the patient. And so you have morning and night for 5 days prior to the treatment. So that's the very first thing that happens. And what is so nice about it is it's doing a lot of the pre-work. So it's prepping the skin, it's getting rid of all the debris. It's like detoxing.
Mhm.
And it takes everything out, and it increases hyaluronic acid dramatically. And so when you are now doing your treatment, you're doing it on healthier tissue.
Mhm.
So that's number one. And then the XOE product is what we apply after the treatment or during the treatment, depending on what type of treatment you're doing. And that is really focused on creating collagen and elastin. But I think the big thing is it's anti-inflammatory. And so we have for years, we do a big treatment on someone, and I tell the patient, okay, now, if you're lucky, you get really red and you swell up. And so if you swell up like a balloon, I want you to throw a party for yourself because it means we did a good job. So that's the inflammatory response taking place. And it does tell you, you've done what you wanted to do. The problem is, I said that so I wasn't getting 10 or 11 p.m. phone calls. The idea is get them excited about swelling. Well,
Mhm.
nobody is really excited. They can fake it a little bit, but the whole thing is you don't want to walk around like a pumpkin head. And so we find that with the product using XOE, that doesn't happen. It blocks that whole cascade of inflammatory activity. And so people they get into the healing process so much faster. And so what we have found in the, I don't know how many months we've been using this product now, probably what, about 8 months, we have found that it's been amazing. We did a split face study, and the side of the face that we used the XOE product on, within just a few hours, but definitely overnight, was so dramatically improved over the other side. So the other side would be swollen and red, this side would not. And so for patients, that's a big deal.
Now I have to ask Larry, we at our practice at Skin Boss Med Spa in Michigan, we also have XOE, and I want to kind of pick your brain because you've worked so heavily with human growth exosomes and now plant-based exosomes. What are your beneficial key points that you love about the plant-based versus human-based?
I think they all work.
Mhm.
So I think they work. I haven't, anything that we have tried has worked. I think the big differentiating factor is that this product, the XOE line, is a comprehensive approach as opposed to a one time. So you have a pre, you have a treatment, and then you have a post. And what really happens with that is you have an increase in collagen
Mm-hmm.
by roughly 28%.
Mm-hmm.
You have an increase in elastin by 35%.
Mm-hmm.
You have an increase in hyaluronic acid by 10%. So when you think, wow, we got that much more, that's almost like having done a whole nother treatment,
Right.
right? And 20 of the applications are done by the patient.
Mm-hmm.
We find when the patient participates in their treatment, things go better.
Uh,
The compliance.
They're more invested, right?
They're more invested.
That's
Hmm.
right. And so we love it. So when I'm doing a consultation and I'm going through this, and so much with the consultation and doing treatments nowadays is the value proposition.
Mm-hmm.
What value am I getting for my money? So you're going to do a great treatment with your Aerolase product or whatever product you're using. You're going to do a good job,
Mm-hmm.
and but they need to understand that beyond that, you're doing something that in essence is giving them the results of another treatment,
Mm-hmm.
and that's built into the price. So that it's not like, oh, well, now I need to think about, do I want to do this or spend that? It's not that expensive. Now we buy in volume, so our cost, I think, is less than $100 for an entire kit,
Mm-hmm. Mm-hmm. I think it's like 93. I think it kind of
yeah,
breaks down. Yeah.
something like that. So,
And that's
it's
so
quite,
affordable to
yeah,
throw in. Yeah. Hmm.
Versus the $800 you started with, right, Larry?
that's right. That's right. And so I think, understanding that exosomes is here to stay. And we do PRP, we do
That's what
PRF.
Ashley and I were going to ask you about. What do you think about the difference, with PRP versus exosomes?
So when you're doing PRP, number one, you need to have either a nurse or a phlebotomist or someone
Yeah.
dealing with the blood, right?
Mm-hmm.
So that's issue number one. So if you have a lot of estheticians or laser technicians or whatever, you need to bring somebody else in to do that whole component. So that's an issue. And the second thing is the cost of it is quite high. So we find that doing exosomes is less expensive, can be done by anyone, and
Mm-hmm.
as far as the results are concerned, we like the results better. And we
Ashley has a really good point. She had brought up to me earlier about how if someone's immune system or lymphatic system isn't healthy,
Dietary, anything.
and
yes.
you're taking their blood and their plasma, how effective is it going to be if they're not healthy to begin with?
Well, not only that, like our patient base is probably, primarily female between 40 and 80.
Mm-hmm.
You take a 60, 70, 80-year-old, are you going to have the same benefit as someone who's 30? Probably not.
Right.
And so, if everyone you're treating is coming in young and healthy, well, they probably don't need a lot of your services, but obviously everything's going to be better.
Right.
And I think with this, it takes all of that out of the equation. And this is so easy. It doesn't, you don't have to refrigerate it or freeze it.
Spin it in the centrifuge.
Well, and that was my thing, Larry, too, is I feel that human-based growth factors, I think it's great. I think human-based growth factors and human-based exosomes are great, but the simplicity of the plant-based exosomes, you don't have to have it at the 40 degrees Celsius, the viability of the shipping, all of that.
Yep, that's exactly right. You're not dealing with any of those issues.
Mm-hmm.
And, the shelf life is a couple years. It's not like this is going to go bad. You don't have to worry about heat.
Mm-hmm.
Because we're doing it with light-based devices. So
Mm-hmm.
it's not a concern. It is readily absorbed, so you don't have to inject it. There's a new product that they've got that we are testing for hair.
Mm-hmm. The topical.
Yeah, you don't even inject, you just put it on.
I'm so excited about this.
And some of the before and afters I've seen are like ridiculous. I mean, it's like so good. So I think that, I think the direction, Do I think there's a place for PRP and PRF? And, we do PRF gel and we do, a lot of that, we're injecting it back into the tissue. And there are places for everything, and doing it, especially around the eyes to get rid of darkness and doing that type of treatment. But for the everyday treatment, this is amazing. Now we were going to conduct a study and we've just gotten crazy busy, but they did one patient where they applied, they did a Visia.
Mm-hmm.
And those people out there who have Visia, what you
We do.
know, it gives you the skin age.
Mm-hmm.
And so it gave the skin age of the patient. They applied the product,
No treatment.
no treatment. They
Yep.
applied the product. They waited 3 weeks and they did another Visia, and there was a reduction of 2 years.
Wow.
Just for topical application. Isn't that crazy?
Topical application. So I
Just
think the whole new area is exosomes of some kind. Now, we like it because it's comprehensive. And when I'm trying to sell a whole package to a patient, we're going to do this, and then we're going to do this, and we're going to do that, like a full non-surgical facelift type thing. And you're looking at, maybe 15 to 18,000 over a year.
Right.
What all are you doing? What all combination? Well, when you come and you lay out, this is part of all of this. You're going to get this at no additional charge. And this is your your treatment, and your post. I mean, they love it. And I do think that not only that, so that's the value added that you're definitely adding, but if you're getting a reduction in skin age, we use that as a goal. So I
Mm-hmm.
have a 55-year-old patient. I'm looking at their skin. It says that their skin is, say, 60.
Mm-hmm.
And so I can say to them that 1 year from now, I'm going to have it at 55 or less. And in 2 years, I can have it at 50 or less.
And the outcome's going to be there.
The
Right.
outcome's going to be
And
there.
if you were just doing device-based treatment, so you will get there eventually, but this is just taking you there so much
A whole
faster.
new level.
So much faster, with less pain, less, irritation, less other, possible problems that you could have, less redness, less swelling. You're back in the ball game. So we did fractionated resurfacing on a number of these split face studies.
Mm-hmm.
And, where we put the XOE on just one side and did the protocol. The difference the next day, if they had it on both sides of the face, all they, take a shower, clean any blood off, they could go out and about and no one would have known. I mean, after a, moderately aggressive fractionated resurfacing, where when they left, they were bloody everywhere.
Mm-hmm.
And I think, when you can turn that around overnight, that's a big deal. But even if it takes an extra day, I mean, it's so far
Yeah,
advanced.
even if it takes a day off.
Yeah.
So I have to ask you, have you used the exosomes with at the Aerolase devices with reverse?
Yes. Well, what we're starting to do is use it on more things, and we're set to have a number of meetings this week about it, where we add it to every single procedure,
Mm-hmm.
no matter what it is. Can we build this? Because now we're starting to see, okay, everybody gets better.
Mm-hmm.
Things are improving so much. Can we make this part of every Aerolase treatment, even if it's not reverse? If
Just
it's
neo.
neo,
Mhm.
yeah. If we do photofacial, if you do anything, I mean, if we can build in that protocol to it, and if there's the money there. And so a lot of times I tell, offices that, everything has gone up. Raise your price
Influx.
$100. Nobody's going to leave you over that. And now you've got exosomes on every single treatment, and just buy it in volume. And the only thing that's going to happen is your patients are going to love you even more. You're going to get a much better outcome, probably a lot faster. And, what does that do? Well, that's word of mouth. That gives you advertising. That gives you a lot of stuff that you don't have to really pay for. Because if you can have all these happy people because you're doing something maybe that others aren't doing,
Mhm.
that's a big deal. That's very helpful.
I have to
And
say, oh, go ahead. Sorry.
well, the whole idea came up because I just did a Visia on me. And the
Mhm.
last time I did it, which, was stupid, but it was a year and a half ago. And I have a 9-year change in my skin age.
Wow.
Yeah, for the better. So now
Amazing.
I'm getting greedy now. I'm going for 15. It's like, well, shit, if I can get 9, why not 15? Why not
Go
20?
for the big guns. Yep.
Yeah, so I think the thing is it's such a motivational thing, and then you get excited about it because it's a real number. I mean, yeah,
Mhm.
we can do reds and we can do the brown spots and we can, do a little reverse and make your skin a lot softer and smoother, and it's just beautiful and tighter. But
But
what
taking that age away, the age factor away, it's really something, it's always when you can visually see a change or you have proof of a change, that proof is really gives you just that security that you're not doing something that's not effective.
that's
Absolutely. I was going to say, Larry, that, in our clinic, I did, one of our directors, we did, a treatment on her, and we used the reverse, and we did another one this year with XOE. And with doing so, I could not believe, after doing a neo, then putting on the exosomes, and then doing the era portion of it, I could not believe how much her tissue responded to that. It almost looked like the tissue wasn't vaporizing, Katie, with like your little plumes. And I was like, oh no, is it blocking it? It's because her tissue is so healthy with all that extra hyaluronic acid that we did side by sides for 5 days post through that. And the change is so crazy. When we got done with the reverse, she wasn't even pink. Like the exosomes just kind of really calmed everything down. The next day, you wouldn't even known that she might have just looked a little flushed. That's it. Her heal time was cut probably 2 less days, which is crazy because reverse already with the microsecond technology brings that down. But to bring it down even more is incredible because, as you know, Larry and Katie, this day and age, nobody wants downtime. They want those results, but they don't want any downtime.
They don't. They want that lunchtime, something they can do and not be down for a long period of time. And this allows that to happen. It's changing the game and getting an aggressive treatment, but not being stuck in your house for 10 days. So
Exactly.
now maybe it's a day or two that you're a little bit,
Mhm.
not back to normal. And I know just with the era, everybody loves it. And what I love about the era is you can customize the depth of ablation.
Mhm.
So if someone just wants a quick 11 microns into the skin ablation and you throw the exosomes on there, there's really, it's nothing.
You can do, so I don't mean to keep talking about the Visia because I actually,
Oh, I love it. I
I,
love you talking about Visia. I love the Visia.
I hate Camfield.
I like the product though, I have to say.
But the product is nice. But you see, when you have texture and you're looking at it, and they're in the really low percentile, and 80% of all women have better texture than they do, and you see that, and you have a lot of blue and yellow where it's pitted and all that, and you do 11 micron, just 11 micron. You can do XOE first, do the 11 micron, and there's plenty because you have 3 cc's. I mean, you can do face, neck, chest.
So much. It goes so far.
Exactly. You can put a whole nother coat on, and I'm telling you, then give it, a few weeks and do another Visia, and you'll see the percentage change and how their profile changed from for texture. And so
Texture. Mm-hmm.
see, and you can do that. So what's making their skin age what it is? Well, the texture, the pigment, or the red, and all these lines. Again, even lines. if you go after those lines, what if you did 2 passes at 11, and you
Mm-hmm.
went around there, but you really had them use the XO and then the healing and all that. I mean, that alone, you show this is where you were just 3 weeks ago, and this is where you are now, night and day difference.
It's
And
amazing.
I think that's the key. See, I mean, you have a very objective tool actually showing it and showing how your skin age is being reduced at the same time. So I think using it with the technology is important,
Mhm.
and we use Aerolase every day. One
So
of them.
are you liking your devices?
When I first started, we were first talking about getting this, my number one concern is we have a lot of technology. Will the girls use it?
Mhm.
Because you buy something, but they're used to using something else, their go-to product every day. Are they going to go and use it? They did a couple patients, and all of a sudden it just took off. So every day it's being used,
Yay.
and it was something that I didn't think was going to happen.
Well,
And
you think it's probably redundant, but it's one of its own because of the microsecond technology,
it's beautiful. It is
And it
having
gets
that
great
technology.
results.
That's
At
right.
the end of the day, that's what we're really looking for.
That's right. And we did a course. We have another laser course going on now, but we had one a few weeks ago in which we had 2 people with, I'd say, skin type 5 and 6,
Mhm.
that area. And I don't have any other technology.
They
That
can
would,
do it.
Treat the
yes,
skin type
because
5 or
they would
6.
have been part of the class not able to get treatments if I didn't have Aerolase. And so it was wonderful. We got to do the neo, we got to do hair, we got to do pigment, we got all kinds of stuff.
Awesome.
So we're finding it to be very beneficial, and I think the exosomes is just icing on the cake.
Mhm.
It's just gives that final finish. That is what patients, like we've been talking about, and it's so easy with all the growth factors and cytokinins and everything that's in it. It's just, and I think it's like 17 billion exosomes. I don't know the exact number,
For
but
the XOE.
XOE, I think it's 17 billion. But I mean, it's a ton. And I'm not
Yeah.
sure that's the key thing. I think, just having the combination of the growth factors and the cytokinins, all the stuff is the key. But the proof is in the pudding, and the people love it. They
Mhm.
come
And
back, and now they're asking for it on a daily basis.
Like, can I just buy this to take home every day?
That's right. And we've had multiple patients after having used it with the treatment ask that. So, I don't know if they're going to come out with more of a daily regimen, but I'm sure they will,
Mhm.
because, where you have some kind of combination of the healing, the detox, the overall anti-inflammatory and stuff like that, where maybe people use it 3 times a week or 4 times a week or something like that. But I see a big future, just topically. So,
Now I have to ask, Larry, say you have a patient come in, they consult with you and they're on a time crunch and you really want to get those exosomes in. Do you ever just say they want to be there in like 2 days for their treatment? Do you ever just do that and then give them the detox to take
yeah.
home to do after the repair and still see great results?
Yes, because no matter what, you can do the repair and you have some detox left. There's always some debris. There's
Mm-hmm.
always something that could be detoxed a little
Mm-hmm.
bit. And remember how much hyaluronic acid you still get.
10% is huge.
Yeah, I mean and you still get some collagen and elastin out of it.
Mm-hmm.
That, but anytime, we're in Arizona, I mean, if you can pump up the skin, I mean, it's freaking desert. So, 23% average humidity, everybody needs it. And so if you're getting more HA, what a win-win situation that is.
yes.
Yeah.
I have a question that just kind of popped into my head. So the Aerolase the Era is the only ablative device for skin types 5 and 6 that we, can do safely without concerns of hypopigmentation.
Mm-hmm.
Do you feel that, and the way we do that is by taking some of the trauma out of the treatment by cooling and our microsecond, our short
Mhm.
pulse.
Yep.
But do you think that exosomes will actually also take some trauma?
Yeah.
I think
I
it would
think it
only
does.
help with the chances
Mhm.
of when you're doing an era treatment, having even less chance of trauma.
Well, it's, so why does darker skin hyper or hypopigment? It's not
Oh.
because they have more melanocytes or anything like that. It's because they're more sensitive to changes in temperature.
Mhm.
And so
Mhm.
using cooling helps. But if you did a pre-treatment, and you
Mm-hmm.
have more HA, that's really, really good. I mean, the target for erbium is,
Water.
moisture, water.
Right.
And so it makes it easier. See, it's less work for the device really to get the outcome. And so
Mm-hmm.
I think from a standpoint of making it safer, reducing heat, both during and after the treatment, doing another application after, I think, and you have plenty to do it. It's not like, oh, I need to open another vial or something. It's usually
Mm-hmm.
plenty. So always having that, I think it's just fantastic. Big,
Yes,
yeah, I
I
do.
do
I think
too.
it would help make it even safer.
I
But the
agree.
technology as it is really good for that because there isn't anything else out there that can resurface at all.
On the darker. I taught a lot of laser biophysics and laser courses, and I ran into the same situation with my students when I had a 456. I was so limited to
Mhm.
being able to treat them. And once we brought Aerolase on board at the school, I mean, I'm going back 10 years ago. um, we never we looked back because it gave the opportunity to those students that the other students had for years. So now I could incorporate the entire class into being able to get treatment and to be treated because I had the Aerolase.
Well,
That sector you couldn't fulfill, you could just fulfill at that point. I mean, that's the amazing part.
it should be in every school. I mean,
I
because
agree.
the opportunity to be able to treat and have them participate, which is what the whole training is all about.
Mm-hmm.
So, it's been shocking to us how much we use it. And, uh, and I think until you get to know a product and all its benefits and patients come back, and I can tell you that we've gotten this reputation with it that now the vendors from companies are coming here to get their acne treated, to get
Mhm.
things like that. I mean, one of the
By
big
Aerolase, right? And they could get it treated by so many other things, but they choose to come and have Aerolase do it.
they're asking, you have Aerolase, I'm coming to you because they've heard.
I love it.
And it's starting to get out there. And so we're doing one of the girls from one of the really big companies. And she said, yeah, I knew you guys had this and I've heard from more than one person, having, Dr. Chilla Curry and all those guys, backing all this up is very, very helpful.
Mhm.
You start treating somebody that's really got bad acne and they have two or three treatments, and it's like, whoa, what a
Night and day.
difference. And it's not horrible. We're not talking about a horrible type treatment at all.
No, easy,
Feels good.
Yeah,
just
it's easy. And
warm
so,
air.
yeah, so we keep finding more and more things that it's of benefit, and we're loving it.
That's
Isn't it amazing, Larry, that when you talk about this and you've been doing this for 20 years, just to like as we sit here and talk, you and Katie and I, and we think about technology and how far in the last 20 years that you've been really focused on this, it's come. Isn't it kind of exciting to think like the future and how much we've pushed the ticket and adding exosomes in with ExoE, and obviously we can do Fitzpatrick's 1 through 5, obviously with all Aerolase devices. Don't you get excited about how much we've made history here?
Well, it's again. So I started, 26 years ago, and I remember photofacial in those days was one pulse every. I can't remember if it was 12 seconds or 15 seconds, but by the time I did one pass on the face, I knew the whole family. I knew about the dog. I had
2 hours, we're done.
yeah, it's like, my day's over, doing a photo facial, and hair removal was even worse. So it's
Oh.
like now, I mean, everything has changed so much, so
It
much.
has. It's amazing.
I think while the technology and mechanical devices continue to improve, the technology and the, exosomes and stem cells and all of that is improving. More and more knowledge, more and more things are going to be coming out. And I think as those two combine, we are actually going to be able to deliver what we've been talking about and wanting to do all along.
All along.
Yeah,
Hmm.
yeah. It's like, again, the value added is a very big deal, and that's what allows you to charge what you want to charge for this
Mm-hmm.
and a fair price. But I think the big thing is outcomes.
Yes.
If you can deliver outcomes that other people are not delivering, they're going to come back to you. They're going to bring their family, their friends, and you become a referral site. And I think that's really a big deal is to combine technology that's making a difference, whether it's mechanical type technology or it's a chemical type technology, whatever it is.
Hmm.
Doing that nowadays is huge.
Combination treatments are just huge. And it's so impressive of all the things that are out there. But Ashley and I, with our podcast, what made us want to do this was we saw such a lack of education, not just in, practitioners, but in the consumer.
Yep.
And how willing they were to just walk into any med spa or plastic surgeon's office, dermatology, and have a treatment done with no information, not understanding even what's getting done to them, not being taught that home care and all the things they do to their skin outside of the office, how important that truly is. We were so frustrated. We were like, we should do a podcast and talk about how important education is on both levels, for the practitioner to be educated and for the consumer to educate themselves prior to getting any kind of treatment and make sure they're going somewhere where it's reputable and, everybody there knows what they're doing and that they're safe.
And it's hard because there are med spas and clinics opening up all over, and we want the consumer, and obviously we want the practitioner to know what they're doing too, but we want the consumer to know that the proof is within that company as well. And I think, Larry, when you said earlier about, combination therapy and people referral, retention is huge. Obviously we want new patients to come in, especially at the practice I work at. We want new patients to come in, but we want to be able to retain those patients that we already have, because that's like a big family to us, and I feel retention is huge. And I feel you probably get great retention with your amazing products that you're using and having your state-of-the-art clinic and using things that work. There's so many people that come to our clinic, at least, and they say, I did this series and I did this, and I don't really know what it was, but whatever it was, I paid, $3,500 total, and I don't really see the change, but they told me the change is there.
Yeah.
And they have to show the proof. And we always do at our clinic, showing the before and the amazings of what we see. And like you said, obviously we love the Vizia, don't love the company as much, but the Vizia helps them see that. It helps see their investment. It helps us protect their investment. And I think that that's huge. I think that, as Katie said, I mean, Katie and I could go on all day probably with you talking about education because you're such a wealth of knowledge, but it's hard when you see those clinics that don't invest in their education, or the people that don't invest in education before they go there.
And the doctors and nurses who are in a different field and they just have had enough and they just decide one day I'm going to open a med spa. Well, that's all wonderful, but I don't think you don't learn lasers and skincare in medical school.
Yeah.
So.
Well, I think the education is critical. It's such a big thing for everyone. Our consultations take an hour and a half.
So important. Patient expectation, consultation.
It takes time,
Takes time.
patient. And combination therapy, like this is what we're talking about today, is really combination therapy. And in 2006, we created CT3, which meant that every time a patient came in, they were treated for color, tone, texture, and tightening. CT3. And we have used CT3 for years and years and years when we're evaluating skin, whether it's Visi or whatever. And then how are we treating? Because if you treat those four things, and of course, tightening will automatically come with it. So all of these things play such a big role: combination therapy, education, all of that. And if you want to have a patient for the rest of your life, their life, you need to do a good job from the very
A hundred, absolutely, 100%. You can get them in there the first time, but it doesn't mean you can keep them. You have to show
Show
them
the results.
show
Yeah.
the results to keep them there as a long-term patient.
Yep, exactly.
Well, Larry, we are so grateful that you came on today. It was such a great,
Such a pleasure.
yeah, really a pleasure. And I know you're a busy person, so we really appreciate it. I said to Ashley, I'm going to reach out and see if he would come. And she was like, yeah. And I was like, I don't know. He's so busy. And right away, you said yes. So we were so honored and
Grateful.
Well, we like doing it. If it helps with education or anything, of course, we want to be part of it. And it's always worth taking time to help people anytime you can, and what goes around comes around. I think it's all win-win.
Well, we greatly
are right on.
greatly appreciate you.
Yeah.
So thank you so much, Larry. And we hope you have a fantastic Friday. And someday I hope I see you in person. I would love to meet you.
Yes.
And thank you so much. We really value your opinion and your expertise in education as well. So thank you.
Fantastic. Bye-bye now.
Have a great
Bye.
day.
Yep. Have a great day.
That was so fun. You're on mute, Katie. You're on mute. You're on mute.
See, we didn't have
Hi.
any technical problems. All
Okay, everybody that's listening right now, I have to tell you, my dogs have been outside barking. I'm
I
pretty
didn't
sure,
hear them at
like,
all.
but I'm like, people in my neighborhood probably think that I am that person that doesn't take care of my dogs. So as we're sitting here talking, I'm like, oh my gosh, please, the person that's walking by, I don't think we're super annoying. They are in like an electric fence, but I was just thinking about how you and I always have these fun
Always.
quirks with
There's
our
always
dogs,
something happening
always
in
with
the
our dogs.
background.
So
But
gosh,
that
he
was
was such a
great,
breath of fresh air. He
yes.
is so great. I
Really.
value his education and expertise so much. So thank you,
Yeah.
Katie, for reaching out to him. That was incredible. And
I remember, when I went there to his facility when Larry brought Aerolase on, and I went to Clearskin, and I was like, I wish Ashley was with me.
someday that's on my
Because
bucket list. We'll have to go back and visit
It
him.
just, you heard him saying, like, education, and you and I, this is like our passion.
What goes around
right?
comes around.
So seeing a facility like his, being so invested in education, and the latest, things for their patients. And when they brought Aerolase on, it was such an honor because, for them to bring our devices into their school, obvious, he knows what he's doing, so
Yeah.
he's super impressed with Aerolase. So that is a lot to be said about, our technology.
I'm super happy. I'm so excited that we got to actually talk to him on here. And I love that he is all about education like we are. And it was phenomenal. And I'm so glad that he brought Aerolase on. And as you saw, he said like what an honor it was to treat the Fitzpatrick's, fives, and so on and so forth, where he could do that in a training because a lot of people miss the boat.
He said it, his exact words, every school should have an Aerolase. And it's really true.
It is true because I feel fortunate enough that I did a 2-year internship underneath an African-American dermatologist, but at that time we didn't have all the devices to treat Fitzpatrick's higher than 4. We didn't have that. So I think every school should. And I think that obviously you and I preach it all the time because our love for Aerolase, and everybody should experience Aerolase ablation and non-ablative. I think that that's where a lot of companies miss the boat because they can't treat all clientele. They can't do
Exactly.
everybody with laser-based therapies. And
Nope.
I think that's huge. So I'm really glad you got him on. So thank you, Katie, for
Yeah.
facilitating that. And
So I guess we have to wrap it up for the day.
we do. So I was thinking, because, you know, we're coming into October, I think we should get on here and do like a Halloween themed, even though it won't be Halloween yet, but I think we should do a Halloween themed session.
I am with you. We'll
I
do
think-
it our next session.
And maybe we could share some bloopers of
Let's
just
do
silly
that.
stuff. So I want you to dress up for Halloween on here. I'll dress up.
I'm
if you
not
dress
a
up.
big Halloween person, like the dress up factor. Like I like all the other parts, but I'll do it.
Okay. It can be something little. I think it'd be fun. And for
I
people
wish
that
my
watch us
daughter,
rather
who
than
lives
listen,
in
it'd be great.
Florida was here because she is unbelievable at
Makeup
scary
artist. Oh, I love
Yes,
it.
You can make me look crazy, but she won't be here at the time. But
Well, give it your best effort and we'll have Amanda decide if you did a good job or a bad job. She'll just have to watch.
okay.
So, all right. Well, until next time, thank you everybody
next time.
for joining
Love
Katie
you.
Cutler and I on
Great.
Peeling Back the Truth. This was number 13 with
Yep.
Larry
Thank you,
Helwig.
Larry,
He was
so much.
amazing. I will see
Clearskin
you in a couple
Institute.
weeks, Katie.
Thank you. Yep. Bye.
Have a great day.
You too.